Hello, everybody. My name is Ligia Filgueiras, and I'm going to talk about the social determinants of health of a young Quilombola population in Amazonia, Brazil. This work is from me, Ligia Filgueiras, Hilton Pereira da Silva, and Edson Ramos. I am from the Pará State University, and they are from Federal University of Pará. So quilombolas, first of all, are groups formed by populations originated from Black Africans who lived in Brazil as slaves. And as any other groups from the Amazon region, they are considered vulnerable, especially children and adolescents. They have a specific way of life. They live by subsistence agriculture, artisanal fisheries, extraction of forest products, selling products in street markets and local markets. So our objective was to evaluate nutritional status of young people in relation to social determinants of health and the World Health Organization international parameters. So this is an exploratory, descriptive, and retrospective study. We analyzed 6 quilombola communities in the states of Pará, Amazon region, Brazil. We had 664 children aged 0 to 19 years old and young people. 358 women, 306 men. We use anthropometry and questionnaires on social determinants of health and bioanthropological items as kind of environment they live in, conditions of water, sanitation, kinds of house, living perspectives, educational perspectives, and others. So 5.8% of our children from 0 to 4 years old are in a long and severe delay in growth in relation to height for age. And 19% of them are at risk of being overweight. Almost 28% of women from 15 to 19 years old are also at risk of being overweight. So this is a situation that we have been facing here in Brazil that we call nutritional transition. In a same house, we have children who are in delay in growth, but living together with other members of the family who are overweight or sometimes obese. In relation to sanitation or running water, there is no, it's an absence in almost all the communities. Homes are still precarious. There is no internal bathroom, which indicates high levels of intestinal parasitism, skin infections, and other diseases as diarrheas, because if you have no internal bathroom, it means you have to go out at night to use the bathroom, right? And this is also a risk, especially for children. And as we have so many diseases, this will make your body expend energy instead of growing. It prefers to heal from all the infections that we have here. So this indicates many studies here in the area indicates that high risk for future diseases as obesity, diabetes, and arterial hypertension. This is a picture of Quilombola house in the community of Santo Antônio, in the municipality of Concórdia, Pará. As we can see, they are made of wood. Sometimes it has only one space, one bedroom, one living room. Okay. There are no schools in these communities. When there is a school, it has only the elementary level. High school is not presented, so the teenagers have to leave their communities to the urban centers in order to have high school, which is very expensive though. And as you can see, these populations that have Black people always face structural racism and necropolitics of the state. And they have to face high rates of violence, even if it's territorial, environmental, or physical. Concerning their environmentals, there are many companies that destroy their environment, steal their lands, and this can cause a lot of violence, especially physical, and sometimes assassinations. So here we are in field performing anthropometry and the evaluation of health. And despite the specific laws for the Black population, such as the PNSIPN, which is National Policy for the Comprehensive Health of the Black Population since 2009, these Quilombola populations are still far from international growth parameters in the 21st century, especially after the COVID-19 pandemic, syndemic, and they had a lot of difficulties dealing with the COVID-19. So we hope these results can be used to strengthen public policies in health and education in order to combat and prevent racism and the advance of chronic degenerative diseases. We hope to discuss more with you, and here are our references. Thank you for staying with us. Hope you have questions. Thank you. Bye-bye.